when my mother collapsed in my own arms abruptly, and I could not resuscitate her, even after having been known as a clinician in the community who was saving lives day in and day out, heart transplantation, artificial heart pumps, but I could not save my own mother. And that degree of helplessness is something that has stayed with me all my life, and it always conditions me to look at patients individually and look at them with great attention to their own personal stories. Because within their own personal stories, going deeper than just a simple diagnostic of a disease itself is where the answers are often found, particularly in situations where we still have lesser understanding of human suffering. One of the biggest challenges that I see with our patients is the behavioral tendency to deny and stay in a state of denial about the attribution of their symptoms or the possibility of disease. If we have a headache, we always just say, I think it's eye strain. If we have pain in the chest, instead of saying it's pain in the chest, doctor, try and tell me why it is, I'll try and say, I think it was my muscle that was hurting, or I think I may have stretched my arm a little bit too much. So this attribution of denial is a big challenge for us. And in fact, I know of cardiologists who have ignored their symptoms while they were working and have then come to me with weakened heart muscles because they ignored a heart attack. The future of heart care is immense. First, there is a genetic revolution now where we can, in fact, use genetic scissors to change the human genome in a way as to abolish various heart diseases. We're already at the precipice of disruption in that arena, and the next decade will actually take us very far, where we can treat heart disease just simply by doing genetic testing and then modifying the genes to improve the chances of not ever having the disease develop. The second area where we see great advances in heart care is in device technology. We now know that off-the-shelf devices, for example, either for diagnostic monitoring or for intervention, or to the extent of what I practice in, which is heart replacement therapy, we were always conditioned to replace hearts with a biological human heart. But because we don't have enough donors and enough organs, we need off-the-shelf technology, and using and developing novel biocompatible heart devices that can in fact replace heart function, biorobotic hearts, for instance, is another generational feature that we'll see in our lifetime.
My understanding is that every human being is also a doctor of heart. And you are the lucky one to be the doctor of heart from the romantic side in human life as well as the real expert on the heart. Our guest today is world-renowned Dr. Mandeep Mehra.